And so the provinces are now bracing for delays in vaccine shipments. Ontario Premier Doug Ford says the province is evaluating the impact of today's news. For more on this, I am joined by retired General Rick Hillier, who is, of course, heading up Ontario's vaccine rollout. The big question, Rick Hillier, how big a blow is this?
Well, it's a bump in the road, Catherine. You know, this is a mega operation just in Ontario, let alone Canada, let alone globally. And so if 6, 7, 8 months from now, we look backwards and this is the only bump in the road that we've had, we'll be pretty happy indeed. So, yeah, it is a bump in the road. Yes, it is going to slow our vaccination program somewhat. It is not going to stop it. We will guarantee and be able to guarantee, even with the reduced supply, the second needles in the arms of people who have had Pfizer and now need that second needle. And we, of course, have the Moderna. And with that Moderna and the Pfizer, we're concentrating on those in the most vulnerable circumstances, and that's what we'll continue to do. So yes, a bump in the road, a little bit of a healthy bump that makes us all pay attention here and make sure we got it right, but it's not going to stop our vaccination program, that's for sure.
A healthy bump. That's some real optimism there, Rick Hillier. I'm wondering, though, you had set a goal, February 15th, to have all staff and residents of long-term care vaccinated. Does this news mean that you're going to have to revise that date?
No, I don't think it does, but we are, I will say, crunching the numbers quite literally right now. Mm-hmm. There are 626 long-term care homes around Ontario with their residents and their essential caregivers and staff and healthcare workers, and we think we'll get them all done. We're more than a third of the way through them right now and rolling to others quite literally as we speak. Most of that is Moderna. Some of it was Pfizer, and that part is what we'll have to revisit. But I believe that we'll get them done by the 15th of February, perhaps even a few days earlier still. And that is our focus because, as we know, that's where COVID-19 has been visited most tragically. And those people are held captive to that virus when it enters. We'll get it done. I'm pretty certain we'll get it done by 15th of February.
So who is going to have to deal with the brunt of this then? Who is going to have to wait for their vaccination?
Well, it's not necessarily waiting. It just means that we're going to roll our program out in a different manner. And so it'll be some of the healthcare workers that will perhaps be a little further down the line. We want to make sure, of course, that those healthcare workers already who have had the first needle will get that second needle. And we'll want to support, if we can, with Pfizer still in the long-term care homes, because we do want to get that done rapidly. So it probably would be in the healthcare workers where we'll be slower in February and in March than we would have wanted to have been. But if the vaccines start coming in their allocated amounts or predicted amounts in later February, early March, or if indeed we do get some bump in production in March, then we'll be able to catch up relatively quickly. And that's what we would want to do, obviously.
You, with your military background, I can only imagine contingency planning is a big part of what you do when you look at this. You think something like this is going to happen again? I mean, you said at the beginning, hey, if it's the only one, great. But if we want a sort of reality check for people not only in Ontario, but across the country, are more bumps in the road like this likely? Is that something that you have factored in?
Well, I think the question would be like this. You know, we're constantly scanning the tea leaves, if I could put it that way, and I'm not making light of it. Yeah. Mm-hmm. You know, last week we saw the media reports that some European countries could have an interruption in Pfizer supply. That immediately kind of raised our hackles, and we started thinking about that. And so, yeah, we expect to have some interruptions. But as I said, it's not going to stop our program. Mm-hmm. It may slow it for a period of time. It may cause us to be a little later getting to a specific group than we really want to be or thought we could be. And if we get some extra allocations, like I say, in March or even April, we'll catch up really quickly. We've got a machine turned on in Ontario right now, Catherine. You know, I just give you one example of on Tuesday morning, just a couple of days ago, we had delivered in Ontario by Tuesday morning 143,000 doses of Pfizer vaccine. And we had administered by that morning just over 140,000 of them. So we've got a machine turned on. It's an 18-wheeler. We need lots of vaccines in the tank to be able to operate it efficiently. And we'll operate it, and we'll use whatever vaccines we've got, and we'll do our best for the people of Ontario. And they need to be confident the vaccines will come.
I'm going to throw some more numbers out there, and I don't want either of us or the audience to get buried in them, but I think it's a relevant point. You said that Ontario will soon have a baseline capacity to vaccinate 40,000 people a day. Up until today, there have only been 2 days, as I understand it, where the province managed 15,000 a day. So what's going on there?
Well, first of all, there have been a lot more than 2 days when we had more than 15,000. And in fact, one of those days we had 20,000. We didn't need to ramp up to that level. And in fact, we were using the vaccines faster than they were arriving. And we had some of our vaccination centers this past week actually run out of vaccines and stop vaccinating for a day or 2 days. And then we did some reallocation to try to keep those systems going. But within 96 hours, we could ramp those systems just with what we have now. The 19 vaccination centers, we could ramp those up to 40,000 per day. On top of that, we would bring in the family physicians and the pharmacies, and the pharmacies themselves have an enormous capacity. And that's part of our planning for later in phase 1 and phase 2, when we get many, many, many more doses of vaccines. We will start warming that part of the vaccination system up, start turning it on slowly. Not right now while the vaccination allocations have been reduced, but as soon as they're back up to any kind of what we had predicted before, any kind of predicted level, we'll turn those on. And actually our capacity, by the 1st of April or earlier if we wish it, will be 150,000 needles in arms per day or more. And that's what we're aiming at. We want to be able to do as efficiently as possible, which means also as quickly as possible.
Are you satisfied with how the federal government has handled all this? And I don't just mean today, but you've heard other provinces, and at one point I think we could sort of question what Premier Ford said, talking about Alberta talking about essentially going around the federal government. We know at one point Premier Ford was talking directly to vaccine manufacturers. How's the federal government doing?
Well, something, I'm so busy running our operation. All I want to know is when are the vaccines arriving and how many will we get on any given week, and then we've got a full operation. That's my commitment. Something. Look, I have a trust. No, Catherine, I have a trust in our country here. Everybody from our Prime Minister in the federal government down to the Premier of Ontario and the Ontario government, every single one of them wants to do right by the people that they represent, that they lead. And they want the vaccines. They want them as quickly as possible. And they're moving heaven and earth to get them. I am confident of that. And I trust in the leaders to do what's right for their people, because I believe that's what they're doing.
And I appreciate also, sir, that you are not a politician. But I am going to ask you a question that I asked the federal procurement minister earlier in the show, which is, when we look at the global picture, Canada is 10th when it comes to getting its population vaccinated. Is 10th good enough for Canada, do you think?
No, I want to be number 1 in the world. But actually, what I want more than that is I want to be finished the vaccination program so that the people of Ontario, my part of the mission, have had an opportunity to get the vaccine, and hopefully 100% of them will take that opportunity. But you can't rise up past 10th in the world if you're operating only with hundreds of thousands of vaccines for a population of 37 million. We're going to have millions of vaccines in order to change that ranking. And we can put them into the arms. We just need to have them manufactured by Pfizer, by Moderna, or potentially a third or a fourth vaccine manufacturer, and delivered through Canada to Ontario. We'll get them in the arms, but you can't do it unless you have the vaccines. Okay. Well, thank you for your insight in this today. Appreciate it. Catherine, my pleasure. Thank you. And I'm not a politician. You're right. That was a bit of we'll call it a diplomatic answer then, if not a political one. But pleasure speaking to you. Thank you, Retired General Rick Hillier. Thank you, Captain.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.